Question 1. Healthcare quality management. A healthcare organization has recently adopted a total quality management (TQM) approach to improve the overall quality of care delivered to patients. The TUM framework includes regular feedback loops from various departments, staff involvement, and a commitment to continuous improvement. However, some employees have expressed concerns about the implementation of this framework, citing resources for proper training and support, which they believe may hinder the success of TUM. In this situation, what is the most critical action that leadership should take to ensure the TQM framework's successful implementation? A. Reduce the focus on employee involvement and instead rely on external consultants for guidance. B. Ensure all employees receive sufficient training and support on the TQM principles to promote ownership and engagement. C. Focus solely on achieving the desired outcomes without addressing employee concerns. D. Disregard employee feedback and prioritize implementing EQM processes strictly according to the manual. Answer. B. Ensure all employees receive sufficient training and support on the TQM principles to promote ownership and engagement. Explanation. In total quality management (TQM), the involvement and empowerment of all employees are central to its success. Proper training and support are essential for creating a shared understanding of the principles and ensuring everyone is equipped to contribute effectively to the improvement process. Addressing concerns ensures that they are engaged and motivated, which is essential for the success of the quality improvement initiatives. Disregarding employee feedback or focusing only on external guidance options and C would create disengagement, undermining the core principles of TUM, which emphasize collective effort and continuous improvement. Option D, prioritizing the manual, disregards the importance of employee engagement in the TQM framework. Question 2, patient safety and risk management. The patient safety team at a hospital is conducting a root cause analysis (CA) after an adverse event in which a patient was mistakenly given a medication that interacted negatively with another prescription. The hospital has been focusing on improving its medication safety protocols, but this event highlights a critical gap in the medication verification process. Which of the following would be the appropriate immediate action to take based on the findings of the RCA? A. Punish the healthcare provider involved to prevent future errors. B. Immediately update medication verification protocols and retrain staff on the new procedures. C. Ignore the finding as it is an isolated event that does not require systemic change. D. Document the incident for future reference but continue with the current verification process. Answer. B. Immediately update medication verification protocols and retrain staff on the new procedures. Explanation. Root cause analysis (CA) is a critical tool for identifying the underlying causes of adverse events and implementing preventive measures. In the case of medication errors, the most appropriate response is to address the systemic issue by updating protocols and ensuring that staff are retrained on these revised procedures. This patient safety and helps prevent similar incidents from occurring in the future. Option A, punishing the healthcare provider would not address the root cause and could undermine a culture of safety. Option C dismisses the findings, ignoring the opportunity for improvement, while option D merely documents the issue without implementing any corrective actions, which is inadequate for addressing patient safety concerns. Question 3, data management and analysis scenario. Dr. Emily Carter is managing a hospital's quality improvement program. The hospital has recently adopted predictive analytics model to forecast patient readmissions within 30 days. However, she notices that the data used for predictions is being pulled from multiple systems that do not share the same format, making it difficult to aggregate and analyze the data accurately. Dr. realizes that this lack of data interoperability may lead to inaccurate predictions and suboptimal quality improvement decisions. Which of the following steps should Dr. Carter take to resolve this issue? A. Ignore the interoperability problem and proceed with using the available data, as data aggregation is not critical to quality improvement efforts. B. Invest in data management system that facilitates data standardization and interoperability across the various platforms. C. Start using only data from one system to simplify the analysis process, even if it doesn't provide complete view of the patient population. D. With the existing process, assuming that the predictive model will still provide valuable insights despite the data inconsistencies. Answer. B. Invest in a data management system that facilitates data standardization and interoperability across the various platforms. Explanation. Data interoperability is crucial for accurate analysis, particularly when using predictive analytics for quality improvement in healthcare. Inconsistent or incompatible data formats can lead to inaccurate conclusions, which may hinder decision-making and quality improvement efforts. By investing in data management system that facilitates standardization and interoperability, Dr. Carter can ensure that the data used for predictive modeling is reliable and comprehensive, improving the accuracy of predictions and outcomes. Option A disregards the importance of accurate data, while option C narrows the data scope, reducing its predictive power. Option D assumes that inaccuracies will not impact the results, which is a dangerous assumption that could undermine the quality improvement initiative. Question 4. Healthcare quality management. A hospital has adopted a Lean Six Sigma methodology to improve the efficiency of its emergency department. The goal is to reduce patient wait times by eliminating waste, streamlining processes, and improving communication. However, after a few months of implementation, the team has noticed that while wait times have decreased, there has been an increase in patient complaints regarding the quality of care during their visits. What is the most appropriate next step for the hospital leadership to take? A. Focus exclusively on reducing wait times, as this is the primary goal of the Lean Six Sigma initiative. B. Conduct a thorough review of the process changes to ensure that they are not negatively impacting patient care and address any concerns related to quality. C. Ignore the complaints as they do not align with the initial goal of reducing wait times. D. Shift the focus to increasing the number of patients served, regardless of the impact on quality. Answer. B. Conduct a thorough review of the process changes to ensure that they are not negatively impacting patient care and address any concerns related to quality. Explanation. While Lean Six Sigma aims to improve efficiency, it is essential to balance efficiency improvements with quality of care. The increase in patient complaints suggests that process changes may have inadvertently compromised the care experience. A thorough review of the process changes help identify areas where quality may have been impacted and enable corrective actions to be taken. Option A focuses only on efficiency, ignoring the impact on patient care. Option C dismisses patient feedback, which is a critical component of continuous improvement. Option D prioritizes patient volume over care quality, which contradicts the principle of patient-centered care. Question 5. Patient safety and risk management. A hospital has recently implemented a new medication administration system that integrates barcode scanning to prevent medication errors. Despite the new system, there have been a few instances where patients still received the wrong medication. A root cause analysis (RCA) reveals that some staff members have not consistently followed the new barcode scanning procedures. What is the most appropriate correct action the hospital should take to address this issue? A. Reprimand the staff members involved in the medication errors to ensure compliance with the system. B. Conduct additional training sessions for all staff members to reinforce the importance of barcode scanning and the consequences of non-compliance. C. Discontinue the barcode scanning system and revert to the previous manual medication administration method. D. Ignore the findings from the RCA, as the issue is isolated to a few incidents, does not require systemic changes. Answer. B. Conduct additional training sessions for all staff members to reinforce the importance of barcode scanning and the consequences of non-compliance. Explanation. The RCA revealed that the problem lies in the inconsistent adherence to the barcode scanning procedure. Conducting additional training will ensure that all staff members understand the critical role of barcode scanning in preventing medication errors and the potential consequences of not following procedure. Option A. Reprimanding staff is punitive and does not address the root cause of the issue, which is a lack of consistent procedure adherence. Option C would be counterproductive, as the barcode system is designed to improve patient safety. Option D dismisses the findings and misses the opportunity to correct the behavior through education and training. Question 6. Leadership and strategic management. The leadership team at a large healthcare facility is looking to align quality improvement initiatives with the organization's overall strategic goals. The team recognizes that without proper alignment, quality initiatives may not have the desired impact on patient outcomes or organizational performance. Which of the following actions is most critical for ensuring alignment between quality improvement Initiatives and organizational strategy. A. Focus exclusively on quality improvement projects without involving senior leadership in the decision-making process. B. Develop quality improvement initiatives in isolation with no regard for the organization's mission and vision. C. Engage senior leadership in the development and implementation of quality improvement initiatives to ensure they are aligned with the organization's goals. D. Delegate responsibility for quality improvement initiatives to lower-level staff without involving upper management. Answer. C. Engage senior leadership in the development and implementation of quality improvement initiatives to ensure they are aligned with the organization's goals. Explanation. For quality improvement initiatives to be successful, they must be aligned with the organization's overall strategic objectives. Engaging senior leadership ensures that these initiatives are designed to contribute to the broader organizational goals and have the support necessary. Successful implementation. Option. It disregards the importance of leadership involvement, which is crucial for the strategic alignment of quality initiatives. Option B overlooks the need for alignment with the organization's mission and vision. Option D shifts the responsibility away from senior leadership, reducing the likelihood of strategic alignment and successful outcomes. Question 7. Data management and analysis. A healthcare organization has been using data analytics to identify trends in patient satisfaction scores. After analyzing the data, it is found that the scores have remained consistent over time with no noticeable improvement. The organization has already tried various interventions, but the data still fails to show significant improvement. Which of the following actions should the organization take to improve its data-driven decision-making process? A. Continue implementing the same interventions without further analysis, assuming the changes will eventually lead to improvement. B. Conduct a deeper analysis of the data to identify potential root causes of the stagnation and explore new strategies for improvement. C. Discard the data and try a different set of metrics to evaluate patient satisfaction. D. Focus on achieving high patient satisfaction scores regardless of the underlying. Answer. B. Conduct a deeper analysis of the data to identify potential root causes of the stagnation and explore new strategies for improvement. Explanation. If patient satisfaction scores have remained consistent despite interventions, it suggests that the current strategies may not be addressing the underlying causes of dissatisfaction. Conducting a deeper analysis will help uncover any hidden issues, patterns, or barriers that may be preventing improvement. This approach promotes evidence-based decision-making and ensures that future interventions are more targeted and effective. Option. Advocates for continuing without adjusting strategies, which could waste resources and perpetuate ineffective practices. Option C discards valuable data, hindering the organization's ability to make informed decisions. Option D focuses on outcomes without addressing the root causes, which is not sustainable or effective in the long run. Question 8. Patient experience and satisfaction. A healthcare organization has recently implemented patient-centered care initiatives designed to improve communication between healthcare providers and patients. One of the key components of the initiative is a formalized process for handling patient complaints and grievances. Despite these efforts, there has been an increase in the number of unresolved complaints. What should the organization prioritize in order to improve patient satisfaction and address these unresolved issues? A. Ensure that all complaints are routed through a centralized department without involving healthcare providers directly. B. Implement a system for actively engaging patients in the resolution process and providing timely responses to their concerns. C. Ignore the complaints as they are only a small percentage of the overall patient population. D. Focus exclusively on improving clinical outcomes, assuming that this will naturally resolve dissatisfaction. Answer. B. Implement a system for actively engaging patients in the resolution process and providing timely responses to their concerns. Explanation. Active engagement with patients in the resolution of their complaints is crucial to improving patient satisfaction. By involving patients in the process and providing timely responses, the organization can demonstrate its commitment to addressing their concerns, which builds trust and improves the overall experience. Option. As centralizes complaint handling without involving the direct healthcare providers, which may lead to a lack of personalized attention. Option C ignores the importance of addressing all complaints, regardless of the volume, as each patient's experience is valuable. Option D overlooks the importance of addressing patient experience directly, assuming that clinical improvements alone will resolve all issues. which may not be the case. Question 9. Performance and process improvement. A hospital has been using the Plan Do Check Act PDA ICL to improve its patient discharge process with the goal of reducing readmission rates. The team has completed the Plan and Do phases, but during the check phase they discover that the changes implemented have not led to a significant reduction in readmissions. What is the most appropriate next step for the team to take? A. Immediately abandon the changes and revert to the previous process, assuming that any improvements would have been realized by now. B. Reassess the data and identify any areas where the process could be further refined or where additional changes might be needed. C. Continue with the same changes and assume that the desired results will occur eventually. D. Increase the discharge planning staff and focus on making the process faster rather than comprehensive. Answer. B. Reassess the data and identify any areas where the process could be further refined or where additional changes might be needed. Explanation. In the PDCA SUCL, the check phase is critical for evaluating the effectiveness of the changes. When the desired results are not achieved, the team must reassess the data to understand why the changes didn't work as expected. This may involve further refining the process or implementing modifications. Option prematurely abandons the changes without understanding why they didn't work, while option C assumes that the desired outcomes will naturally occur, which is not a data-driven approach. Option D focuses on speed rather than the quality of the discharge process, which may not address the root causes of readmission. Question 10. Health information technology. A hospital has adopted an electronic health record (EHR) system to improve patient care and streamline documentation. However, some healthcare providers are struggling with the new system and reporting issues such as longer documentation times and difficulty finding patient information. What is the most effective approach the hospital should take to address these concerns? A. Ignore the issues and expect the healthcare providers to adapt over time. B. Provide additional training and technical support to help healthcare providers become more proficient with the system. C. Revert to the paper-based system as the EHR system is causing more issues than it solves. D. Mandate that all healthcare providers use the system without further support, as it is now the standard. Answer. B. Provide additional training and technical support to help healthcare providers become more proficient with the system. Explanation. The difficulties healthcare providers are experiencing with the EHR system are likely due to a lack of proficiency. Providing additional training and support will help them become more comfortable with the system, reducing documentation time and improving the overall efficiency of the process. Option. Overlooks the importance of addressing user difficulties. Option C. Dismisses the potential benefits of the EHR system, and option D mandates usage without addressing the need for support or addressing the underlying issues. Question 11. Ethical decision-making in healthcare. A healthcare provider is faced with a situation where a patient requests a treatment that is not medically necessary but is preferred by the patient. The provider is concerned that the treatment may not be in the patient's best interest, but also understands the patient's autonomy in making decisions about their care. What is the most appropriate course of action for the provider? A. Proceed with the treatment, as it is the patient's choice, regardless of medical necessity. B. Refuse to provide the treatment and inform the patient that their request is unreasonable. C. Engage in a conversation with the patient to explore their concerns and provide education on the potential risks and benefits of the treatment. D. Refer the patient to another healthcare provider who may be willing to provide the treatment. Answer. C. Engage in a conversation with the patient to explore their concerns and provide education on the potential risks and benefits of the treatment. Explanation. In healthcare, respecting patient autonomy while ensuring the best interests of the patient is crucial. The most appropriate course of action is to engage in open communication with the patient, explore their reasons for the request, and provide them with sufficient information about the potential risks. Benefits of the treatment. This approach allows for shared decision-making, ensuring the patient is well informed while considering medical best practices. Option. Ignores the ethical duty to prioritize patient safety. Option B. Disregards the patient's autonomy. And option D. Shifts responsibility instead of addressing the concerns directly. Question 12. Healthcare finance and budgeting. A healthcare organization is facing budget constraints and needs to prioritize which department receives funding for the upcoming fiscal year. The leadership team is considering cutting funding to a high-cost department that provides valuable, but less frequently utilized services. Which of the following approaches would be most effective in making this decision? A. Cut funding for the department without further analysis as its services are not used as frequently. B. Conduct a cost-benefit analysis to evaluate the department's impact on patient care and the overall organizational goals before making the decision. C. Increase funding for the department in order to boost its services and make them more widely used. D. Ignore the department's value and make cuts based solely on its cost that departments can absorb the demand for its services. Answer. B. Conduct a cost-benefit analysis to evaluate the department's impact on patient care and the overall organizational goals before making a decision. Explanation. Before making any decisions about budget cuts, it is critical to assess the department's impact on patient care, the overall quality of services provided, and the organization's strategic objectives. Cost-benefit analysis will provide data to make an informed that balances financial constraints with the value provided by the department. Option overlooks the importance of evaluating the department's value. Option C could lead to unsustainable financial decisions, and Option D disregards the department's potential contributions to patient care and outcomes. Question 13. Legal and regulatory compliance. A healthcare facility is facing increased scrutiny from regulatory bodies regarding its compliance with privacy regulations. The organization has implemented several measures to safeguard patient information, but there are still occasional breaches. What should the healthcare facility prioritize to ensure full compliance and prevent future breaches? A. Continue implementing new measures without assessing the effectiveness of current privacy protections. B. Conduct a comprehensive audit of existing privacy practices and provide additional training to staff to ensure understanding and compliance with regulations. C. Ignore the breaches and assume that they are minor issues that will resolve themselves over time. D. Shift the responsibility of privacy compliance solely to the department and no longer involve clinic staff. Answer. B. Conduct a comprehensive audit of existing privacy practices and provide additional training to staff to ensure understanding and compliance with regulations. Explanation. To ensure compliance with privacy regulations, the healthcare facility must thoroughly audit its current practices and assess where improvements are needed. Providing additional training to staff will help reinforce the importance of protecting patient information and ensure that all staff members understand their responsibilities. Option. It focuses on adding measures without addressing the root causes of the breaches. Option C dismisses the importance of addressing the problem proactively. Option D places the responsibility solely on it, which ignores the role of clinical staff in ensuring privacy. Question 14. Continuous improvement and change management. A healthcare organization is undergoing a major transformation to improve its operational efficiency. The leadership team is aware that this change will require substantial adjustments from staff and there is resistance among some employees. What is the most effective way to manage this change and foster acceptance among the staff? 8. Mandate the changes without seeking input from staff, as it is important to implement the changes quickly. B. Engage staff early in the change process by providing clear communication about the goals, benefits, and how the changes will impact them. C. Allow staff to continue with their current practices and wait until the changes are fully implemented before addressing any concerns. D. Avoid involving staff in the change process to potential resistance and simply implement the changes. Answer. B. Engage staff early in the change process by providing clear communication about the goals, benefits, and how the changes will impact them. Explanation. Engaging staff early in the change process is key to managing resistance and fostering acceptance. Clear communication about the goals and benefits of the change, as well as how it will affect their work, will help alleviate concerns and increase staff buy-in. Option. That overlooks the importance of staff engagement. Option C delays addressing concerns, and Option D neglects the need for staff involvement, which can lead to further resistance. Question 15. Risk management and patient safety. A healthcare organization has experienced several near-miss incidents involving medication administration errors. The organization wants to implement a more proactive approach to prevent these errors from occurring in the future. Which of the following is the best strategy to minimize medication errors and enhance patient safety? A. Conduct retrospective reviews of past medication errors to identify patterns and prevent recurrence. B. Implement a medication safety committee and establish a continuous monitoring system for medication administration. C. Distribute written guidelines on medication administration to all healthcare providers and expect them to follow the guidelines without additional support. D. Limit the number of medication orders to minimize the chance errors occurring. Answer: B. Implement a medication safety committee and establish a continuous monitoring system for medication administration. Explanation: to prevent medication administration errors, a proactive approach is essential. Establishing a medication safety committee and setting up continuous monitoring systems will allow for real-time identification of risks and ensure that corrective actions are taken promptly. This approach provides ongoing oversight, involvement from all staff members. Option: the focus is only on reviewing past incidents without preventing future errors. Option C relies on written guidelines without offering sufficient oversight or support. And option D limits care and does not address the underlying causes of medication errors. Question 16. Data management and analysis. A healthcare organization collects data on patient outcomes to improve its care quality. The data is collected from various sources, including clinical systems, patient surveys, and staff feedback. What is the most critical factor to ensure that this data can be effectively used to make decisions regarding quality improvement? A. Ensure that the data is collected from a single source to maintain consistency. B. Cleanse and validate the data to ensure its accuracy, reliability, and completeness. C. Rely on descriptive statistics alone to interpret the data without considering the underlying trends. D. Focus only on clinical data, as patient surveys and staff feedback are less reliable. Answer: B. Cleanse and validate the data to ensure its accuracy, reliability, and completeness. Explanation: before data can be used for effective decision-making, it must be cleansed and validated to ensure accuracy, reliability, and completeness. This process ensures that the data is correct and useful for drawing meaningful conclusions. Option A limits the diversity of data, which may result in incomplete insights. Option C disregards the importance of understanding underlying trends and context. Option D excludes valuable non-clinical data, which can provide important insights into patient satisfaction and the quality of care provided. Question 17. Clinical performance improvement. A hospital is working to reduce the incidence of healthcare-associated infections highs in its intensive care unit ICU. The infection control team identifies several potential sources of contamination but is unsure where to begin implementing improvements. What is the most effective approach to address this issue? A. Begin by implementing an organizational-wide initiative to reduce highs without focusing on the IQ first. B. Conduct a root cause analysis (CA) to identify the most significant sources of infection and focus on addressing those first. C. Increase the use of antibiotics as a preventive measure for all IQ patients. D. Focus solely on staff training and education, assuming that is the main cause of highs. Answer: B. Conduct a root cause analysis (CA) to identify the most significant sources of infection and focus on addressing those first. Explanation: the most effective approach is to conduct a root cause analysis (CA), which helps identify the underlying causes of healthcare-associated infections in the ICU. Once the primary sources of contamination are identified, the infection control team can focus on addressing those specific areas, prevent future infections. Option applies a broad approach that might not address the root causes effectively. Option C overemphasizes the use of antibiotics without addressing systemic causes, and option D overlooks the need for a thorough analysis to identify specific issues beyond staff behavior. Question 18. Healthcare quality standards and compliance. A healthcare organization is preparing for an accreditation survey by the Joint Commission. The organization is focusing on ensuring compliance with safety standards, including medication management, patient rights, and infection control. What is the most critical action the organization should take in preparation for the survey? A. Rely on internal audits and assume that no external review will uncover any issues. B. Conduct a mock survey with external experts to identify potential gaps in compliance and make necessary improvements. C. Focus only on areas with recent issues, disregarding other aspects of the quality standards. D. Wait until the survey date approaches and then address any compliance concerns in a hurry. Answer: B. Conduct a mock survey with external experts to identify potential gaps in compliance and make necessary improvements. Explanation: conducting a mock survey with external experts provides a valuable opportunity to identify gaps in compliance before the official accreditation survey. This proactive step helps the organization address potential issues and make improvements in advance, ensuring it meets all required safety and quality standards. Option is too passive and assumes no issues will be uncovered. Option C neglects comprehensive preparation for all quality standards, and option D delays action until it is too late to address any significant problems. Question 19. Leadership in healthcare quality. A hospital is experiencing difficulties in aligning its quality improvement initiatives with its organizational strategy. There is a lack of communication between senior leadership and frontline healthcare providers. What is the most effective strategy for aligning quality improvement with the hospital's strategic goals? A. Ensure that only senior leadership is responsible for quality improvement initiatives. B. Provide clear and consistent communication from leadership about the hospital's strategic goals and how quality improvement aligns with those goals. C. Assign frontline staff to implement changes without involving them in strategic planning. D. Focus solely on the immediate needs of the organization and ignore long-term strategic alignment. Answer: B. Provide clear and consistent communication from leadership about the hospital's strategic goals and how quality improvement aligns with those goals. Explanation: clear and consistent communication from leadership is crucial to ensuring that quality improvement initiatives are aligned with the hospital's strategic goals. Involving frontline staff in understanding the hospital's broader vision will increase engagement and help create more strategy for improving patient care and operational efficiency. Option isolates leadership from frontline staff, reducing buy-in. Option C excludes frontline staff from the planning process, and option D ignores the importance of aligning short-term actions with long-term goals. Question 20. Patient experience and satisfaction. A healthcare organization is aiming to improve patient satisfaction scores, specifically focusing on the communication between staff and patients. The organization implements new training programs for staff to enhance communication skills and encourages feedback through patient surveys. However, despite these efforts, patient satisfaction scores remain low. What is the most likely reason for the ongoing satisfaction scores? A. The training programs are not tailored to the specific needs of the healthcare providers or patients. B. The feedback from patients is not being effectively used to make meaningful improvements. C. The organization is relying too much on surveys and not enough on face-to-face communication. D. The training programs are too focused on clinical skills and do not address interpersonal communication. Answer: B. The feedback from patients is not being effectively used to make meaningful improvements. Explanation: the most likely reason for the ongoing low satisfaction scores is that the feedback provided by patients is not being acted upon in a meaningful way. While training programs and surveys are important, if patient feedback is not analyzed and used to inform quality improvement efforts, the same issues will persist. Option A suggests that training is ineffective, but it does not address the core issue of using patient feedback. Option C limits the communication strategies to surveys, and option D focuses on the wrong aspect of training, as interpersonal communication is crucial. Question 21. Accreditation and regulatory standards. A healthcare facility is in the process of renewing its accreditation with the Joint Commission. During the review, the surveyor finds that the organization has not consistently documented patient care outcomes. Which of the following actions should the organization take to address this issue and maintain its accreditation? A. Immediately stop all non-essential documentation activities and focus on the required documentation for patient care outcomes. B. Develop a comprehensive plan to standardize documentation procedures and ensure staff is trained in consistent documentation practices. C. Rely on retrospective data collection to fill in any gaps in documentation before the accreditation survey. D. Request a postponement of the accreditation until the organization is fully compliant with documentation requirements. Correct answer: B. Develop a comprehensive plan to standardize documentation procedures and ensure staff is trained in consistent documentation practices. Explanation: the best action is to develop a comprehensive plan to standardize documentation procedures, ensuring that all staff members are trained in consistent and accurate documentation practices. This is essential to meet accreditation standards and to ensure high-quality patient care. Option A focuses on halting other activities which would not solve the underlying issue. Option C is not proactive and fails to ensure future compliance. Option D delays the accreditation process, which could lead to a loss of credibility and trust in the organization. Question 22. Performance and process improvement. A healthcare facility is working to improve its patient flow process in the emergency department ED. The team conducts a failure mode and effects analysis (FME) to identify potential risks and opportunities for improvement. Which of the following would be the most appropriate use of the FME results? A. Use the FME results to identify and address the most critical failure points in the process, prioritizing solutions based on their impact. B. Conduct a root cause analysis of every incident reported in the ED, regardless of severity. C. Rely solely on the FME results to make changes without involving frontline staff in the process redesign. D. Use the FME results to document all potential failures, but not immediate action until further incidents occur. Answer A. Use the FME results to identify and address the most critical failure points in the process, prioritizing solutions based on their impact. Explanation. The FME results should be used to identify the most critical failure points in the ED process, with solutions prioritized based on their impact. This approach ensures that the most significant risks are addressed first, improving patient flow and safety. Option B focuses on investigating incidents without linking them to process improvement. Option C overlooks the importance of engaging frontline staff. And Option D delays action, which can result in continued inefficiencies and risks. Question 23. Healthcare financial management. A healthcare organization is considering switching from a fee-for-service FFS reimbursement model to a value-based care model. What is the most important factor to consider when making this transition to ensure successful implementation? A. Ensuring that all healthcare providers are paid based on volume of services rendered. B. Ensuring that patients are informed about the new reimbursement structure before transitioning. C. Aligning quality measures with reimbursement incentives and focusing on improving patient outcomes. D. Focusing only on cost reduction and not on the quality of care provided. Answer. C. Aligning quality measures with reimbursement incentives and focusing on improving patient outcomes. Explanation. When transitioning to a value-based care model, aligning quality measures with reimbursement incentives is crucial. This ensures that healthcare providers are incentivized to improve patient outcomes and the overall quality of care, not just the volume of services provided. Option. It continues to focus on volume, which contradicts the goal of value-based care. Option B is important but is secondary to ensuring that the new reimbursement model supports quality improvement. Option D focuses on cost reduction but ignores the core objective of value-based care, which is improving both cost efficiency and quality. Question 24. Health information management. A healthcare organization is transitioning to an electronic health records (EHR) system, and the IT department is responsible for ensuring that all patient data is properly migrated to the new system. What is the most important action to take to ensure that patient data remains accurate and secure during the transition? A. Perform a simple transfer of patient data without any checks or validation. B. Use data validation techniques to verify the accuracy and completeness of the data before and after migration. C. Allow individual departments to handle the data migration independently to streamline the process. D. Delay the transition until all staff members are fully trained on the new EHR system. Answer. B. Use data validation techniques to verify the accuracy and completeness of the data before and after migration. Explanation. To ensure the accuracy and security of patient data during the EHR transition, it is critical to use data validation techniques before and after the migration process. This process ensures that the data is accurate, complete, and secure throughout the transition. Option. A lax validation, which could result in errors or data loss. Option C introduces the risk of inconsistent data handling across departments. Option D delays the transition, which is not ideal when a system change is already underway. Question 25. Patient safety and risk management. A healthcare organization is conducting a root cause analysis (RCA) following a medication error where a patient was given the wrong dosage of a drug. The team identifies that one contributing factor was inadequate communication during handoff between shifts. What should the organization do next to reduce the risk of similar medication errors? A. Implement a new medication verification process for all patients during shift change. B. Develop a mandatory handoff protocol with clear communication standards and checklists. C. Distribute a memo to all healthcare providers reminding them of the importance of accurate medication administration. D. Increase the frequency of medication audits to catch errors before they occur. Answer. B. Develop a mandatory handoff protocol with clear communication standards and checklists. Explanation. A mandatory handoff protocol with clear communication standards and checklists will ensure that important patient information, including medication orders, is clearly communicated during shift changes. This reduces the likelihood of errors occurring due to miscommunication. Option is reactive and focuses on verification, which could be addressed by improving the handoff itself. Option C is not enough because a memo does not solve the underlying issue of communication failure. Option D is useful for monitoring but doesn't directly address the root cause. Question 26. Clinical performance improvement. A healthcare facility wants to implement an evidence-based practice to improve patient outcomes in postoperative care. What is the first step in implementing EP to ensure it aligns with clinical guidelines and leads to improved outcomes? A. Review existing literature and clinical guidelines to identify best practices in postoperative care. B. Ask staff to recommend practices based on their personal experiences with postoperative patients. C. Implement a trial period for a single intervention without reviewing supporting evidence. D. Evaluate the cost effectiveness of different interventions before starting the implementation. Answer A. Review existing literature and clinical guidelines to identify best practices in postoperative care. Explanation. The first step in implementing an evidence-based practice EP is to review existing literature and clinical guidelines to identify the best practices that have been proven to improve patient outcomes. This ensures that interventions are grounded in solid evidence. Option B relies on anecdotal evidence rather than scientific studies. Option C is not appropriate because interventions should be based on evidence, not trial and error. Option D is important but should come after identifying the most effective interventions. Question 27. Leadership and strategic management. A healthcare leader is tasked with implementing a new quality initiative aimed at improving patient satisfaction. Which of the following would be the most effective approach for the leader to align the initiative with the organization's overall strategy? A. Implement the initiative quickly and communicate it solely through email to staff. B. Develop a clear communication plan that explains how the initiative supports the organization's vision and goals. C. Allow individual departments to independently design their own strategies for improving patient satisfaction. D. Focus only on short-term goals and not the long-term sustainability of the initiative. Correct answer. B. Develop a clear communication plan that explains how the initiative supports the organization's vision and goals. Explanation. To align the initiative with the organization's overall strategy, it is essential to develop a clear communication plan that explains how the quality initiative supports the organization's vision and long-term goals. This helps ensure that all stakeholders are on the same page and understand their roles in achieving success. Option. It lacks engagement and clarity. Option C leads to fragmentation and inconsistency in efforts. Option D ignores the importance of sustainability and long-term planning for quality improvement. Question 20. Data management and analysis. A healthcare organization is analyzing patient satisfaction survey data to identify trends and areas for improvement. The organization has a large dataset with multiple variables, including patient age, diagnosis, and length of stay. Which of the following statistical methods is most appropriate for identifying relationships between these variables and overall satisfaction? A. Descriptive statistics to summarize the data and provide an overview of satisfaction trends. B. Regression analysis to identify the impact of different variables on overall satisfaction scores. C. Frequency analysis to categorize responses based on patient demographics. D. Data cleaning to remove outliers and ensure data accuracy. Answer. B. Regression analysis to identify the impact of different variables on overall satisfaction scores. Explanation. Regression analysis is the most appropriate statistical method to identify the relationships between multiple variables, such as age, diagnosis, and length of stay and overall satisfaction. This method allows the organization to understand how these factors influence patient satisfaction scores. Option is useful for summarizing data but doesn't identify relationships. Option C categorizes data but doesn't provide insight into the variables that affect satisfaction. Option D is important for data accuracy but doesn't address the analysis of relationships. Question 29. Health information management. A healthcare organization is experiencing challenges with data interoperability between its electronic health records (EHR) system and the system used by a partnering hospital. The organization needs to ensure that patient data is shared securely and efficiently across both systems. What should the organization do first to resolve this issue? A. Upgrade the AIR system to ensure it complies with the latest interoperability standards. B. Establish a clear data governance framework for managing data exchange between systems. C. Conduct a security audit to check for vulnerabilities in the system. D. Train staff on how to manually transfer patient data between systems. Answer: B. Establish a clear data governance framework for managing data exchange between systems. Explanation: establishing a clear data governance framework is the first step in resolving interoperability issues. This framework will define the processes, standards, and responsibilities for managing the exchange of data between systems, ensuring that it is done securely and efficiently. Option addresses the technical upgrade but doesn't solve the root issue of managing the data exchange. Option C is important but comes after ensuring governance and processes are in place. Option D is inefficient and doesn't address the need for seamless data sharing between systems. Question 30. Healthcare financial management. A healthcare organization is considering a shift from fee-for-service (FFS) reimbursement to bundled payment models for certain procedures. What is the primary challenge the organization may face when transitioning to this model? A. Ensuring adequate reimbursement rates to cover the cost of the services provided. B. Managing patient outcomes while still maintaining profitability under fixed payments. C. Implementing a more complex billing system to manage bundled payments. D. Ensuring that patients understand the cost implications of bundled payments. Answer: B. Managing patient outcomes while still maintaining profitability under fixed payments. Explanation: the primary challenge with transitioning to bundled payments is managing patient outcomes while maintaining profitability under fixed payments. Bundled payments involve a single payment for a set of services, which requires the organization to control costs while ensuring high-quality care. Option is important but is part of the broader challenge. Option C focuses on the technical aspect of billing, but the bigger issue is managing the financial model itself. Option D is relevant but secondary to the challenges of managing care under bundled payments.